Cuyahoga County Health, Human Services, and Aging Committee meeting is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown. Here. Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
All right, can we have a motion to excuse Councilman Schron?
So moved.
Moved and seconded. All in favor say aye.
Aye.
Councilman is excused. Can we have a motion to approve, actually, are there any public comments related to the agenda first?
No, Mr. Chair, no one has signed in.
Okay. Can we have a motion for the approval of our minutes from the June 8th meeting? Moved and seconded. All in favor say aye.
Aye.
Our minutes are approved. All right, well, we have one item before us today and a presentation as well regarding MedWorks. So let's deal with our resolution. Chrissy, if you would read that item into the record.
Resolution 2016-0123, authorizing a contract with Emerald Development and Economic Network in the amount not to exceed $1,443,480 for administration of the fiscal year 2015 Shelter Plus Care Sponsor-Based Rental Assistance Program in connection with the HERTH Act Homeless Assistance Grant Program for the period 8/1/2016 through 7/31/2017.
Good afternoon, Council. Ruth Gillette, Office of Homeless Services. Representing the described contract, I kind of gave you the same presentation I did last week, but changed the detail relative to the contract and the services that are being provided through this particular contract. So again, this is a Shelter Plus Care grant award from the Department of Housing and Urban Development. It provides rent subsidies for chronically homeless and long-term disabled individuals and families. So the third slide describes the program components of Shelter Plus Care. Last week, I was representing the tenant-based rental assistance program, which is the scattered site. This contract provides funding for the sponsor-based rental assistance, and these are units that are site-specific. And later on in the presentation, there's a slide that shows the properties that are being subsidized through this particular grant. This is one of a number of Shelter Plus Care awards that comes to the county each year as a renewal. I've highlighted in red that this is the Shelter Plus Care SRA for $1,443,480, and that supports around 200 units with rent subsidies. The next slide just talks about how Shelter Plus Care fits within our overall approach to ending homelessness in our community. This is a long-term subsidy that's targeted to the highest barrier individuals and families to help them maintain housing and not come back into the homeless system. The next slide talks about the clients that are served on this particular grant. I included the information from the TRA grant, which serves through scattered site individuals. This grant, again, provides subsidy to 200 households, and of those 200 households, the SRA grant is highlighted in red. Just to see the contrast, so only 3% of the recipients are families from this grant, 97% are single adults, and that's because this is really targeted to the chronically homeless single adult population. Also, I think it's interesting to note that in general, 8% were served in the scattered site unit, 8% of the individuals were veterans, but in this grant, 16% are veterans. And that really reflects that there are that chronically homeless veterans are disproportionately represented among the single adult population, and they are being assisted through this program to get into permanent housing and stay there. And then again, 100% of the individuals and the recipients on this grant are required to be chronically homeless as a term of the grant. And so the next slide really it shows the projects. And I don't know if you can see it, but they put little red dots next to the ones that actually are utilizing some of these subsidies. So folks are staying at Emerald Commons, at 1850 Superior.
Ruth, are you on page 7?
I am on slide 7. Is it slide 7?
Okay.
1, 2, 3, 4, 5, 6, 7. Yeah. These are all part of our Housing First initiative. And so there's the Liberty at St. Clair, South Point, Edgewood Park. Yeah. And then there's a couple of others that aren't on here that serve a real like youth. This grant supports some youth at Independence Place and at Opportunity House, which are both targeted to youth. I also just want to point out that the vast majority, over 90% of the cash goes to actual rent subsidies. Very little goes to admin, less than 1%. And then the remaining dollars go to support the processing of the rent payments and the inspections and those kinds of direct costs to administering the program.
Repeat that admin percentage again.
It's like around 1% or less, yeah. And that would be like indirect admin costs, like audit costs. Because we have a number of these contracts with Eden, they're able to distribute percentages of those kinds of costs across the grants. And so it's like a net savings overall, so that each grant only pays a portion of like what would be a total administrative burden. And the same with all the other costs. Then the last slide provides the details again of this particular contract, the amount, the number of units that are subsidized, the term. It's 100% funded from the 2015 HUD-Hearth Act, and it was approved for an RFP exemption in early June, and the contract starts August the 1st. And I'm happy to answer any questions.
Any questions from the committee? Councilwoman?
The chair to Ruth, could you mention the youth support again? Which places?
So through the chair to Councilman Conwell, Opportunity House, which is a program of the Humility of Mary Housing Corporation. It's a renovated rectory on the Cleveland-Garfield border. There's 11 units there. And then, so some of these subsidies are utilized at Opportunity House, which helps them meet their operating costs. And then youth who are homeless and who are high need are referred to Opportunity House for housing there. And then Independence Place, which is the YWCA's program over on 40th at Prospect, is also, they have 22 units, and I believe that 18 of the units are subsidized with Shelter Plus Care sponsor-based rental assistance. And we would do more there, but then they have subsidies from other resources that they utilize for the remaining number of units that they have.
You said 22 units?
They have 22 altogether, yeah.
And was that updated and rehabbed in any way?
The building? Yes, that building received Ohio Housing Finance Agency low-income housing tax credits, like 5 or 6 years ago, some time ago. And Cleveland Housing Network was the partner with the YWCA to submit the low-income housing tax credit application, and they were awarded funding and renovated. It's really a lovely building. I don't know if you've seen it.
I think I went before it was renovated, so
the units are really beautiful.
Back when we first started, so I wanted to make sure that was still. So we still, in your opinion, still need beds for youth?
Through the chair to Councilwoman Conwell. Right, so yes, the short answer is yes. We're looking for permanent housing options for youth between the ages of 18 and 24. And of course, my office is doing a lot of work with the Department of Children and Family Services, and a place for me around identifying youth aging out of foster care to develop interventions so that they don't become homeless. And if they are homeless, to identify them and try to relink them to any resources that are available through DCFS, in addition to developing other resources.
Do you think that date will, the age range would change since the state have that legislation in regards to keeping foster care and expanding it to 21? You think that
Right.
that's going to change your age range at that point?
Well, through the chair to Councilwoman Conwell, our age range is 18 to 24, and that's the HUD definition of youth. So it'll be great when DCFS is able to expand their services through 21, and that's a good start. We see that a lot of the youth that were in foster care come into our system around the age of 21, 22. You know, it takes them several years to kind of progress through family and friends and whatever, and then end up, you know, needing shelter. So it's a good start.
Okay, thank you.
Ruth, I go back to, I guess it was 2011 when we first started the conversation around housing first.
Okay.
It was an incredible idea. When I first heard it, I thought it was obviously housing is the first thing needed.
Yep.
Since those initial conversations to where we are now, speaking I guess in broad terms about how successful it's been, describe how it has gone.
To the chair, so when the Housing First initiative started in 2003, the community set a goal of developing 1,000 units. That slide number 7, I believe, indicates that 650 units are currently either occupied or underway. In 2016, a project on Detroit Avenue at West 83rd will open, and that's going to be 60 more units. And then there's a project at Miles and Harvard that is either, well, I think it's under construction, and that will open in early 2017. And then a project was just approved that will open in 2018. So right there is another 100+ units. So, you know, what we realize at some point is because of turnover, you may have 1,000 units, but actually people move on, and then you can fill those units. And so you don't actually need like a unit for every identified chronically homeless person, because there's going to be movement into more permanent housing. So generally speaking, our community we can document a reduction in chronic homelessness from the high to, it's been reduced by 73%. So when we were tracking several years ago, at the point in time count, there were over 700 chronically homeless individuals in the shelter system. And at our last count in 2016, there were 260. So, you know, we will always need this housing, but our community has really made amazing strides in, addressing this issue.
So you have sufficient capacity you're able to meet the demand as people are becoming homeless and then becoming
Right.
stable.
Right.
You have sufficient housing to.
That is the goal. And it's kind of always looking at the numbers, analyzing how many people are coming in, how many people are leaving, to really get to what you were just describing, which is, they call that functional zero, so that there will always be people who need chronic homeless housing, but the idea is that they will be able to be identified quickly and placed in housing within 90 days. So that's the goal of the system.
Thank you. Councilman?
To follow up on the chairman's question, how close are we now to having sufficient subsidized housing available that that everybody who becomes homeless and really needs it and doesn't have other options, that we have housing for them.
To the chair, to Councilman Miller. So really the way we look at this issue is, so it's kind of parsed out. So we know how many chronically homeless individuals there are. We know how many chronically homeless families there are, and we can project how many will develop. We are really trying to determine the number of homeless youth and chronically homeless youth, the number of veterans, and for each of those subgroups, it's identifying the strategy that will meet their needs. And so for the chronically homeless, we would hope that we would be able to announce that we've ended chronic homelessness by sometime next year. And for the veterans, the partners are looking at developing an announcement around ending veteran homelessness this fall. We would like to say that we have ended family homelessness. We haven't actually yet, but we're trying to increase the resources that we have for rapid rehousing. But at the end of the day, I really think that you can't really solve all the problems of affordable housing through the homeless system, right? I mean, there are many, many more low-income families and individuals who struggle to pay rent, and that is really a larger national issue that requires more investment by the government, national government, in either rent subsidies through the Housing Choice Voucher Program or some other way of subsidizing affordable housing for more families and individuals. So.
And Mr. Chairman, Director, are the numbers of homeless people currently increasing, stable, or going down?
To the chair, to Councilman Miller, according to the research and the data that we're collecting, the number of single adults is declining in our community. The number of families had been peaking, but I think it's kind of stabilizing now to around 500 a year. So, I think, again, all those numbers are related to the economy and how, capable people are of securing enough money through employment or whatever to purchase housing. So.
Okay.
Councilwoman?
To follow up on the chairman's question, when you talked about the 1,000 units, just wanted to know the Detroit and the Miles and Harvard, are those dedicated for youth only?
Those, to the chair, to Councilman Conwell, those are not just dedicated to youth, it's to everyone, although the one on the 8301 Detroit has 25 units specifically set aside for veterans. So.
Okay, so 25 out of those 60.
Yes.
Okay, and my other question on to follow on that, will these be shelter plus care?
Through the chair, to Councilman Conwell, so the 8301 building will be a combination of what they call VASH vouchers, the Veterans Assistance, which is a direct subsidy through CMHA that will be project-based to that project. And then the balance of the units will be subsidized through Shelter Plus Care.
So, and what about the Miles Harvard? Is that going to be solely Shelter Plus Care?
Through the chair, to Councilman Conwell. Right now, the expectation is that that would be Shelter Plus Care. However, the Housing First Initiative has been engaged with the CMHA, the Cuyahoga Metropolitan Housing Authority, for the past several years to develop a partnership where, for example, when the building is opening, we utilize the Shelter Plus Care resources that we have. And then the CMHA will issue a project-based RFP, and we're able to compete for those and transfer the subsidy to a CMHA project-based subsidy, which then enables us to reutilize the shelter plus care on a new project. Because at the same time, when we are given the opportunity to apply for more shelter plus care, we have always taken that opportunity as a community. So we're trying to increase the supply of subsidies for the chronic homeless population and the homeless population with disabilities. Does that? It's a mixture of subsidies, is what I'm trying to say, where we are relying heavily on CMHA to be a strong partner.
But if they don't, we're gonna cover it with the shelter plus care.
That would be the plan.
And you mentioned, since we're trying to get in a partnership with CMHA, that will no way affect the other low-income residents out there trying to get CMHA housing.
Through the chair to Councilman Conwell. So that has always been sort of the crux of the issue, right, is the need far, 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 far exceeds the supply. And so how do you decide who is the highest need, essentially, is really what you're trying to discern, right? And so, you know, CMHA has over 10,000 housing choice vouchers, and we're looking at buildings of like 60 units, 66 units, and some portion of those being, you know, targeted to a subsidy by CMHA. So, and arguably, you know, the disabled have traditionally been less successful in attaining CMHA subsidies for many reasons. And so is this a prioritization? Yes, they have prioritized in their admin plan to serve chronically homeless individuals. But is it, I don't think it's unfair. I guess this is a long answer to say it is a prioritization, but arguably it's an appropriate prioritization.
Okay, so it all comes down to not enough units, period.
Right. I mean,
So
right.
we can do a partnership all day long, but it's gonna affect another segment of people.
Right. There just aren't enough resources, so
All right, thank you.
thank you.
Councilwoman Brown?
Thank you, Mr. Chair. The question that I had was with regards to the age, 18 to 40 for the placements. And when we're talking youth, we're discussing them in the 18 to 24 bracket. Is there a reason why we put them all together?
Through the chair to Councilwoman Brown, I'm sorry. So 18 to 24, so the program serves 18 to 70, you know, any age. When we talk about youth and targeting resources to youth, it's 18 to 24. If you're saying like, why is Opportunity House and Independence Place specifically for youth?
Just referencing slide number 6 as we talk about the client profile, I think it would be helpful if we were to separate the 18 to 24-year-olds so we could get
out of the 18 to 40.
right, so we could get
Gotcha.
a better perspective of
Right.
our youth population.
Through the chair to Councilman Brown, I can give you that data. Yeah, but it isn't here, but we have that in HMIS. So.
Councilwoman Conwell? Oh, you didn't? All right, any further questions from the committee? If not, any final comments, Director?
If possible, to move this for approval at the second reading, that would be greatly appreciated in order for it to make the August 1st approval contract start.
Okay, I move that we move this resolution to the full council again under second reading suspension.
Thank you.
Second.
Moved and seconded, all in favor say aye.
Aye.
Ayes have it. All right.
Thanks very much.
Thank you. All right, our final item is we have a presentation, an informational briefing on MedWorks. And if you would please come forward and introduce yourself, welcome.
I will, thank you. Thanks for having me. Good afternoon, Council Vice President Jones and members of the committee. Thank you so much for providing me with this opportunity to brief you on MedWorks and the work we do here for Cuyahoga County residents. My name is Carrie Clark, and I'm proud to be the Executive Director of this organization. So a little bit about MedWorks first. I'll start with the background. MedWorks was founded in 2009, and since then we've helped thousands of county residents. Our offices are in Lyndhurst, but our real work takes place at clinic locations throughout Cleveland and Cuyahoga County. In simplest terms, MedWorks provides free medical, dental, and vision care to uninsured and underinsured patients at frequent clinics in Cleveland and throughout Northeast Ohio. Our organization has a very small staff, about 3 full-time, but we are able to serve thousands of patients across the county thanks to thousands of medical and dental professionals who volunteer to provide services at our clinics. While those volunteers come from the region's top healthcare organization, MedWorks as an organization is completely independent. Now, despite the Affordable Care Act and other recent legislation, there remains a significant need among the uninsured and underinsured for both service and connection to the healthcare system. I don't think I moved here. Our mission is to provide a collaborative portal for every patient who needs quality healthcare and access to permanent medical homes in Northeast Ohio. This mission commits us to 2 crucial and connected tasks: care and connection. This means that MedWorks both provides direct service to patients and also connects those patients to the healthcare system for continuing care. We provide a wide variety of services to our patients, from general medical exams to women's health services, to cancer screenings and medication assistance. We provide vision exams and eyeglasses to those in need. And while we can also provide dental care from cleanings to acute treatments like extractions and restorations. I should mention here that we are planning on a significant expansion of our dental clinics and services in the coming year, thanks to a very generous recent grant from the Center for Health Affairs. Our services are provided through scheduled clinics that we hold throughout Cleveland and the county several times per year, and here's how those clinics happen. We identify clinic partners and services needed and determine a location and a date. Once the date and location are finalized, we promote the clinic through a variety of communication methods, targeting the areas near the clinic location. Our clinics accept walk-ins for a number of services and exams, but some of the more specialized treatments require scheduling an appointment, and we begin scheduling those appointments usually about a month and a half out. On the day of our clinics, we see patients throughout what is always a long but rewarding day. Patients receive services, and just as importantly, they work with our counselors to connect to ongoing services in the healthcare system. So our clinics. Our clinics are the heart of our work. Since our founding, we've conducted 41 clinics, all staffed by amazing volunteer doctors, dentists, and medical professionals. In that time, we've provided more than 26,000 services to more than 12,000 patients, averaging more than 1,500 patients each year. Some recent clinics have been held at Stephanie Tubbs Jones Health Center in East Cleveland, Neon Southeast Health Center in the Union Miles neighborhood, Neighborhood Family Practice on the near west side, East Tech High School, North Coast Health Ministry in Lakewood, and dozens of more. We average about 6 to 8 clinics a year. Our patients. At each of our clinics, we collect some information from our patients. That collective data has told us a great deal about who uses our services. To begin with, our patients are predominantly women, 61% compared to only 33% men. Additionally, the majority of our patients are between 40 and 60 years of age. Sometimes when people learn about MedWorks, they assume that our patients are mostly homeless and jobless. That is not accurate at all. More than a third of our patients have a high school diploma or GED, and more than a quarter have a college degree. And while 54% of our patients are uninsured, 46% do have at least some form of insurance. Our clients are diverse, from diverse circumstances. While almost a quarter of them say they have never had health insurance, more than 40% of our patients report they have a primary care physician when they come to our clinics. The uniting factor among many of our clients seems to be the financial burden of health care. 37% say they would forego care without our clinic, and 20% were dealing with a high cost of previous healthcare treatments. Through dozens of clinics and thousands of patients we've seen, we've learned that there remains a gap in healthcare between what patients need and the services that can most meet those needs. This continues to be the case even with the Affordable Care Act. We've learned that many of our patients don't know how to access traditional safety net services that may be available to them. Our patients fall into 4 general categories: patients without access to any insurance, patients who have some access to insurance but are underinsured, patients who are eligible for Medicaid or other programs but are unaware of their eligibility, patients who are eligible for Medicaid or other programs but have hesitation or fear around utilizing it. I've talked about our clinics, our volunteers, and our patients, and before I go to the end of my presentation, I would like to show you a short video that will give you an idea of what we look like in action, as long as it plays. What we do is twofold. So we not only provide this acute medical care, which is what we're doing today. We're going to see patients, we're going to address whatever is bothering them today, but then also we're going to connect them to a source of ongoing medical care.
We now have about 3,500 medical, dental, vision volunteers and social workers and pharmacy and lab techs that make up the MedWorks Army of volunteerism.
Over the past 3 years, we've been able to help hundreds of patients receive follow-up cancer care, cancer screenings that have really resulted in early detection, and it keeps patients from coming into the hospital with late-stage disease.
MedWorks had an advertisement on the television, so I went in and told them the problem, and I had basically some pain. I needed to find a place which I could get some information, medical information, and when I told him the symptoms, etc., he checked me, and his immediate response was, "You need help, fast." They immediately put me through surgeries and chemotherapies and radiation treatments.
Signed up for a 4-hour shift, and I technically never left. And the reason I did it was during that clinic, we had a young man who came in with women's eyeglasses. They took him sometime in the afternoon. He walked out with 2 pairs of glasses, tears coming out of his eyes, the biggest smile on his face. So at that point, I was hooked.
It's a great safety net to have for the community. You know, people go to emergency rooms in pain. It costs the community and the taxpayers so much money, and they often don't get treatment done. They get put on pain medication or antibiotics and told to go see a dentist. So in trying to help with access to care, we have this opportunity to see, in just a few hours, hundreds of people.
It's been life-changing for many patients, and I say that because so often I talk with patients who haven't been to a doctor in years. And this is an opportunity for them to come out, get their problems taken care of. The patients can get assigned to their own doctor who coordinates a team of healthcare providers to manage all of their healthcare needs. When I think about the impact that a day like this will have on our patients, it's monumental.
It's very important because there's a lot of people that are not able to afford it. They can't go to, and they can't go to the doctor if somebody don't take it. So it's very important that they have these clinics.
I am awaiting the tests in a couple of months and the results to make sure that I'm clear and can kind of relax a little bit. MedWorks saved my life.
So we deliver all of our services totally for free, and obviously MedWorks wouldn't be possible to do what we do without a huge amount of support. And we're very fortunate to have so many organizations in our community who are supporting our work. And here you can see a list of just some of them. I don't have enough room here to list the many volunteer medical professionals who've just made such a difference in the lives of our patients. So after this, you may be wondering how you can help. I'm going to try to give you 3 ways, or maybe 4, actually. First is simply helping to spread the word about MedWorks to your constituents. Your constituents come to you with needs and challenges, some of which could possibly be addressed by MedWorks. I hope you encourage those in need to contact us. Second, our clinics don't succeed unless patients hear about them. Any help publicizing upcoming clinics would help us and help your constituents in need. Third, hosting our clinics is a significant challenge, both logistically and financially, as I'm sure you can imagine. Every clinic faces regular problems like securing parking for patients to paying to rent equipment and space. Logistical or financial support from our partners and sponsors is crucial to making these clinics a reality. Lastly, I hope you will share information with your council colleagues. Here are our 3 upcoming events, and there are details in your packet, and as more become available, we are more than happy to share with you. And then if there are any questions I could answer.
Thank you, Director Clark. Committee, are there any questions? Councilwoman Conwell?
Through the chair to Ms. Clark, are you similar with CareSource and things of that nature? Just trying to understand.
So you're gonna have to forgive me if I don't follow protocol. Am I supposed to say I was
Don't worry
noticed?
about
Okay, good. So CareSource is, an insurance provider. So one of the hard things about us is that there's nothing like us. So for us to describe it, we basically move around the community, and it's almost like a MASH unit. So we have our team of volunteers, and we'll go to a location with a partner who's generously donated it. We don't pay for facility. Our overhead costs are very low. And then we pop up basically a mini hospital. So we'll run many specialties on one day. The whole goal is to drop all the barriers and questions and provide a very simple, easy access to what might seem a complicated system.
Okay, because I was familiar with the inside of the Huff
Yes,
dental
the
clinic, so
oh,
I just
yeah.
was trying to understand how you actually fit into an already existing healthcare clinic. So basically, you just do events for that day to assist them with, I don't know, the overwhelming. They market for you to let people know that
No,
you're
so-
coming.
So really, if you think about us as we are a complementary partner to our FQHC, so all of our federally qualified healthcare centers, the safety net providers use us really as their outreach arm. So really, we market for them because our goal is to, and what we found is that when we drop these barriers, when we don't ask any questions, we make it really easy. You don't have to even tell us your name. But when we do that, patients come in droves, and they're much more likely to actually sign up. They go through the insurance counselor. So when I said we have insurance counselors, so about a third of our patients don't even know they're eligible for Medicaid before they get there. They are able to provide that information. They leave with presumptive eligibility, and then they leave with an appointment. So let's just say Neon, the Huff Center that you're located. They bring us in because they know we're doing a service for the community, and the patients, especially our dental care, the extractions are of huge need. They bring us in, and our patients are then connected to their facility. That's our goal. So in our outreach, we comb the adjacent neighborhoods because we really want it to be easy and accessible. So when they come in, they see that at Huff, I can get my child immunized, I can get my women's health procedure and dental. And so they come back, and about 70% of our patients keep the appointments that they make that day, which is an extraordinary show rate. But we think it's because they know it's easier, it's a friendly entry point.
So other than Huff, do you participate at Metro and other hospitals as well?
Yeah, so we partner with every system. Okay. So every FQHC that we have, so Caroline's, Free Clinic, Neon, Neighborhood Family Practice, we have events with all of them. Metro, Cleveland Clinic, and University Hospitals all supply volunteers. And then we also have events at their locations. So Metro, for example, our event October 1st is at their new site in Cleveland Heights. that they just took over the
Right.
health band locations. Yeah, so we're gonna be raising awareness about that venue. So that's another bonus for our partner. And we'll let the neighborhoods and the community know that there is this low-cost option for them.
Councilwoman, Councilwoman Brown, I can see you.
Thank you. The question, just to kind of get a little bit more clarity, you do pop-ups at the clinics. Is that safe to say it's kind of like a pop-up type?
Yeah, actually, some of our partners here today call it pop-up clinics.
Okay.
Yes.
And then the other thing that I was curious to know, that we have upcoming clinics. The first one that I have in front of me is October 1st. Do you have any between now and October 1st?
So we do. We have a vision clinic, actually, and the reason it's not in your paper is because we're starting to take appointments for that right now, and it's probably, as we're talking, full. Because vision, so if we talk about vision and dental as the two biggest needs, so your medically underserved population looks a little different from your vision and dental because a lot of people might have basic medical insurance and have no vision and dental insurance. And if you think about a $200 pair of glasses, that is a make or break for a lot of our families. So what will happen is we opened appointment line this week and it'll be full. We'll have 600 patients signed up probably now. We're only able to do them once per year. Cole Eye Institute gives us their whole building. So that's part of who we are and what we do, and sort of the respect we've built over the years, is that a partner like Cole Eye Institute literally hands over the keys to their building to us once per year.
Now, how are the people that are in need how do they know how to contact you and when for this, specifically for the vision and dental?
So people wait, they know, and then we target specifically homeless shelters, and then it's really our patient. We're trying really hard. We only do community outreach. We send our teams of flyers into the most need neighborhoods and the homeless shelters. So those are our priorities. We don't ask questions, so we make sure our outreach is very targeted, especially for vision.
Okay, so primarily shelters and flyers in the populations where you feel the need is the greatest.
That's right. It's only flyers and shelter. Right.
Okay, thank you.
Councilman Miller?
So, with the appointment scheduled well in advance, I presume we're not mostly talking about emergency situations. We're talking about people who know they have some problems, but they're not severe enough that they would go to the emergency room, and this provides another option. Is that correct?
Yes and no. So the majority of our patients do have chronic illness, and that's who we primarily treat. Every clinic that we've had, we have at least one or two emergency transports, so people who knew they woke up that day. So our medical services and sometimes our dental are walk-in. We don't take appointments. For general medical, we never take appointments. You can come anytime we're having a clinic on those days. Now, the interesting thing about dental is that people will wait in pain. So dental pain, this is why the Center for Health Affairs gave us the grant. Dental pain is the #1 reason for emergency room visits. So because the pain becomes so intense, they can't cope and they wind up in the emergency rooms to get their tooth pulled and treated with some antibiotic. So what we do at dental clinics, before we were only able to do extraction only, which is just pain alleviation. Get rid of an abscess, get rid of the tooth. We'll do surgical extractions even. But now with the new grant for the Center for Health Affairs, we're going to be able to make some prosthetic teeth, which is amazing because we used to just pull the teeth and then they would leave with the gap in their mouth and that didn't feel right. So we're actually going to be able to do some restorative dental now, which is incredible. But that is an emergency room patient that we're taking away. We know for sure.
So, with respect to general medical,
Yes.
when you say that you don't take appointments, how is the scheduling done? Do people just come at the beginning of the day and sit for hours waiting for their turn, or is there some way of scheduling them for? Do they get scheduled for particular times when they come in, and then they come back later in the day when their appointment? How does this work?
Yeah, that's a great question, because I think a lot of people think, you know, we have our patients waiting, but our goal is to treat somebody exactly how they would get treated if they were insured, as close as we can. So we take appointments, and from that appointment, the influx of calls that we take, it's not exactly scientific math, it's math we know for doing so many, is that basically the amount of appointments we take, the no-shows that we'll have plus walk-ins are right around that amount. So we schedule that many doctors, and then our doctors don't go home until every patient is seen. So they have been known to stay hours after. They've been known to see patients in the administrative offices. They do anything. These people are some of the most incredible people you've met, but we've never turned away a medical patient.
So are you saying then for general medical that you both take appointments in advance and you take walk-ins?
Correct.
And the walk-ins are kind of scheduled into the spaces created by the no-shows?
Kinda, yeah.
Yeah,
So I mean, we figure it out. We know exactly. I mean, not exactly. We don't know anything ever exactly in this business, but we accommodate them. We know how the scheduling pretty much in the flow goes, and how to get patients through as quickly as possible. They're there about an hour and a half. General medical.
How do you see the ongoing changes in the Affordable Care Act as affecting the way that your organization would work?
So we've actually seen it. We've got a firsthand view of the immediate effects. So just for example, we used to do 130 pap smears at a women's health clinic. We do 35 now. That is directly linked to, that is a mandated service by insurance providers. They have to cover it. Where we have seen the emerging need is really in this underinsured population. So our population of underinsured increased by 50% in just 1 year. So what we're seeing now is more and more people who have high deductibles and out of pocket. And that's how we're covering. So we see that that is going to continue. We don't see an immediate end to the underinsured. We also do not see any end to the gap in dental and vision.
And do your clinics do anything about helping people take on a more preventive focus about improving their own health care?
Yes, well, we try at every point to integrate that. You know, our doctors are teachers, and our doctors also are very passionate. So that's a self-selected group who decides to come on a Saturday. They are so excited to be able to spend more than, you know, their 10-minute allotted time that they normally can. They take all the time that they can with their patients. We just started a program with the Cleveland Food Bank. It's called Food as Medicine, where we have pallets of fresh produce that are dropped off. Our doctors talk directly about the effect of nutrition on whatever they've met with their doctor about, whether it's on their diabetes diagnosis, their hypertension, and how we're drawing the connection between that. And again, because of the way we work, that we want to make this hot connection to the resource. We have the food on site. They know exactly where they're going to come back to get more of that same produce. So we take every opportunity we can to do that.
Well, I appreciate all your good work in filling a gap and providing some very much needed service.
Thank you.
Are there any further questions from the committee? Councilman?
So it states, Ms. Clark, that it's free medical dental. I was just wondering how are you funded or kept up in
Exactly,
this?
every day,
Right.
always on the hustle. No, we actually are 100% philanthropically funded, so we don't have any We're not a Medicaid provider. We don't have government grants even. That was a conscious decision that would keep us a complementary provider to our partners rather than a competitor. So it's all foundation and individual funding and in kind. So while we may only have an operating budget of $300,000, the real budget is closer to $1 million when you think about all these facilities that are donated to us. So.
And so just wondering, so you're funded 100% philanthropic. When you talk about dental and vision, do they look at to fund you per the individuals you serve, or the extractions you do, or is it just up front and then you're free to utilize it any way that you like?
Well, it's mostly so when we write our grants, we say we will see X amount of patients per year, and it's usually right around 1,500. I don't think, other than the Center for Health Affairs grant, where we said we would serve a minimum of 600 patients, that we break it down particularly by service. We do have some funders who are just funding our prescription program because we do 30 days of free prescription and we pay for that with the local pharmacy. So some of our foundations help us underwrite that cost.
So I guess two final questions. You mentioned the Co-Eye Institute. Do you have the date for that?
It's August 13th.
And then I hope my final question would be, you spoke earlier about, to Councilwoman Brown, identifying the need, where the need is and how you market. And you had mentioned basically the homeless shelters. Well, we had just, earlier you heard the presentation that there's also sites.
I was listening.
Yes. That you can market to. So I just wanted to bring that to your attention. And probably a very low-income area would be the CMHA housing units. So I don't know if you market to those areas already, the projects and things of that nature, where those individuals are struggling to meet the rent. So I would just assume that they would also probably need the vision and dental. So is that something that we can help you with, or you already have a handle on?
Oh, no. We take help everywhere we can, especially with patient outreach, because really another effect of the Affordable Care Act is, the uninsured that are left are the truly isolated. They're the hardest to reach and build the trust to get into this system that feels very, very complicated. So that is where we welcome help all the time. Anyway, we will take you up on that.
Okay, I'll try to make some connections for you.
That would be amazing.
Do you actually help individuals become better insured when they, obviously you mentioned a few services where Affordable Care Act kicks in, it's reduced the services that you deliver. Those individuals, I think you mentioned 35 for one particular service. Do you help those 35 individuals get better insured?
Yes. So at the end of every one of our clinics, our patients meet with social workers who identify any other needs and refer for other resources, insurance counselors who will qualify them right then and there if they're ready, if they qualify for Medicaid and they go through the qualification and they have eligibility. That is what we call the win-win-win. So we've connected a patient, the patient leaves insured, and the FQHC who has seen the patient, they have look-back capabilities, so that anything that is handled from that patient is reimbursable from that day. So that is a big priority for us to qualify our patients for any other benefits that they do qualify for. Then they can also, we have the counselors for the marketplace too during open enrollment.
Excellent. Are there any other questions from the committee? All right. Well, Director Clark, we appreciate you coming by today.
Thank you.
What I've tried to do is, when I became chair, to open this forum to invite those in the human services world to come and share, to promote you, to make sure the county learns more about what you're doing. And we appreciate what you've done today. Would you like to introduce any of your team that's here?
Well, look, this is my fan club.
Fan club. Everybody's got to have a fan club. That's all right.
These are my partners at Our Strategy. I don't know if you guys know any of them,
We
but
know
they're
some of those faces,
yes, they're helping us. Well, because we saw this need for to grow our patient outreach efforts. We have a small team of people who help us, so they're helping us with the strategy, getting us connected to this group in particular. And then this is one of my staff members, Tanya. So she's doing a great job all the time. She's a public health person. That's where we
Okay.
get our data. Yes.
All right, well, again, thank you for coming by. We appreciate it.
Oh, I appreciate the opportunity. Thank you.
You're very welcome.
Well, Chrissy, do we have any miscellaneous business?
No,
Or
Mr.
anyone on
Chair.
Anyone committee? Chrissy, has anyone signed in for public comment?
No, Mr. Chair.
All right, well, if nothing else holds our attention, our committee meeting is adjourned.
Ms. Clark, is your